Okay.
All right, you ready?
Yeah.
Don't don't say anything until I tell you. Action.
Hello and welcome. Empire Medical Training has, hang on 1 second. Can you cut that? Okay, hello. Microphone's working. Fantastic. Hello and welcome. My name is Michael Erber, and I'm the Director of Finance and Administration for Empire Medical Training. For over 22 years, Empire Medical Training has provided healthcare professionals with top quality continuing education in the field of aesthetics, anti-aging, pain management, medical, and surgical. We have worked tirelessly to provide each and every one of you with virtual training in a time of need. I encourage each and every one of you to pay close attention to this short video clip detailing a little bit more about our upcoming programs. Thank you.
That we want to also be able to do is to use small volume for bolus injection.
My entry point is going to be right here. Now, it's important to note the depth of placement.
Thank you all for taking a few moments to check out our new virtual training. The resources from today's lecture on IV nutrition therapy can be found on your members portal at mymembersportal.com. Simply use your email and your password to log in and download these great resources. In addition, on your members portal, you can find videos on demand, protocols, and register for many more upcoming virtual training. Over the next few months, we will provide not only virtual training, but our 5-star aesthetics, anti-aging, and pain management consortium. We will bring you live programming, live streamed over our channel from major KOLs throughout the nation. Every morning, you'll be able to tune in live to our station and network to watch these KOLs speak about not only their pearls from their practice management, but how to engage with their patients on an ongoing changing environment. Thank you again for being part of our training today, and enjoy the program. Thank you. Changing environment. Thank you. As well as answer each and every one of them. If you have any other specific questions, feel free to email info@empiremedicaltraining.com or contact your local account manager. Thank you again and enjoy the show.
That we want to also be able to do is to use small volume for bolus injection.
My entry point is going to be right here. Now, it's important to note the depth of placement.
thing that we want to also be able to do is to use small volume for bolus injection.
Like my entry point is going to be right here. Now, it's important to note the depth of placement.
Them that one or talk to them that one? That one. Okay.
But right now we're here.
So now we're right here?
Dr. Vera, it's wonderful that you invited us to your practice today to speak about an important topic, IV nutrition therapy. Why is IV nutrition therapy important to yourself, your practice, and your patients?
Well, it's something that you can do in your practice, so it's a nice supplemental procedure that you can do. If done safely, the risk of anything going wrong is very minimal. It's a nice moneymaker. It also maximizes the results for the patients so that you can really treat them from the inside, not just on the outward appearance.
Wonderful. Thank you so much, and we'll chat later.
Awesome. Thank you. So that everybody can listen to them and learn while we're at home. So again, today we're going to be discussing IV nutrition. I'm going to be going through the slides. pharmacy to work with, get to know them as far as which formulations you want to use, because basically you want to be able to streamline the process so that you can take human error out of the equation as much as possible. So, when you do IV nutrition, you're able to really get these concentrations of the different minerals or vitamins that you're using, and you are able to really maximize the results because you're able to bypass first order of
that we want to also be able to do is to use small volume for bolus injection.
Like my entry point is going to be right here. Now, it's important to note the depth of placement.
coronavirus crisis that we're living. So as far as things that we can do, I wanted to discuss IV nutrition because this is a way for us to really kind of boost our immune systems so that we can be best prepared for whatever virus, infection, stresses that we may be enduring over the next few weeks to
I have no
months.
sound for some reason. Okay, now we have sound. Just keep going. Start again. Sorry about that.
Start that part again.
Yeah. The introduction. Yeah.
We'll do that one more time. What is that?
Hi, how are you?
Hi, how are you? Dr. Vera, I want to thank you again for inviting us to your practice in Plantation, Florida, to talk about an important topic. You had mentioned to me that IV nutrition therapy is not only important to yourself, your practice, but it's greatly important to your patients. Why is that?
Hi, everybody. So my name is Dr. Carolina Vera. Thank you for having me and thank you for listening. So today we're going to be discussing IV nutrition. The nice thing about IV nutrition, particularly because we're being faced with our pandemic, with coronavirus, it's a nice way to really boost your immune system so that in these times of stress, of possible illness, that we can, confront the issue with our bodies working optimally.
Oh, great, fantastic. Well, I look forward to seeing your presentation.
Thank you. All right, so today we're going to be discussing IV nutrition. So I'm going to be going through the slides. I'm not particularly going to be reading everything on the slides. I want it to be a little bit more hands-on and a little bit more clinical. So everybody should have access to these slides so you can read them at length in the comfort of your home. So I hope everybody's safe. But I'll be really discussing more of the clinical aspect of IV nutrition, why you should do it, why you should bring it into your practice. So as far as bringing this and attaching this as part of your practice, it's a nice adjunct, not only monetarily, but it's great to be able to offer patients that full, like 360 kind of care. So most aesthetic practices focus on the Botox and the fillers and the lasers, but it's very nice to be able to really treat somebody from within. So if our body is working optimally, obviously we're going to be able to maximize our results for the things that we do on the exterior. Like I mentioned, it's a nice way to bring in some passive adjunct income into your practice. If done appropriately, this is a relatively safe procedure. Again, it's something that you really should be trained at. It's something that you should feel very comfortable with. There are many compounding pharmacies that have protocols to really help you and make administering an IV infusion very safe. Okay, so because the trend in medicine is really going into that wellness, it's a great time to bring this into your practice. So I highly recommend that you consider doing IV nutrition in your practice. It could be administered by a nurse, a paramedic, by the physician, by the mid-level, but of course, you should always check with your specific state laws to make sure that you are in compliance. So the other thing is, why not just take a multivitamin, like a pill a day? It has all to do with the bioavailability. So when you do IV, number one, you bypass the first degree order of absorption, so you're getting a more pure and a higher concentration delivered to the body, and you're also bypassing some of the GI upsets that occur with some of the PO by mouth type of medications. All right, so during this lecture, we're going to kind of go over some of the drip rates. We're going to kind of go over the difference between osmolarity and osmolality. You're going to be having different guidelines that we are going to show you and talk about. And we're going to show you as well as complications, what to look for, who aren't ideal candidates. Obviously, it's all about documentation because remember, if it's not written, it didn't occur. So we're going to kind of go over what's proper documentation as far as what you should be doing for every patient. So the first thing, let's get the lingo down. So osmolarity and osmolality. When we talk about IV infusions, we're going to be really talking about osmolarity. And osmolarity is defined as the concentration of solution expressed as a total number of solute particles in 1 liter of solvent. So we're talking about liters, we're talking about volume, we're talking about osmolarity, as opposed to osmolality, which kind of deals more of weight in kilograms. We don't really discuss or refer to our IV nutritions in that form. So when you think IV nutritions, we're talking osmolarity. And this is going to be important because we want the osmolarity of the IV infusion that we're creating to be very similar to that within our bodies so that it's accepted and we don't run into any of the complications that we'll discuss further. Super important. You want to make sure that everything as far as the IV infusion is concerned is properly labeled. You want to make sure that you document what you gave the patient, what was the dose amount, what was the rate that it was given. You want to make sure that you monitor the patient's vital signs. So you're going to be taking vital signs before the procedure, definitely after the procedure, and it's a good recommendation to do it as well in the middle during the process. Of course, you want to make any note if the patient has any side effects during the procedure so that this is going to come into play for future administrations. Let's see now. So we talked about safety in administering this in a safe manner. When you bring IV nutrition into your practice, you do have to be prepared to have what we call a crash cart. This crash cart should be available in the room that you are supplying the IV in. It consists of having IV epi. It consists of having steroids, whether it's in the form of IV or by pill. Your staff should be ACLS trained, so in case of an emergency, you should have things like oxygen, IV supplies. You should be able to monitor vital signs, so a blood pressure cuff, an AICD. These things are all what's included in your crash cart. So make sure you know where the crash cart is, make sure everything is labeled appropriately and that everybody in the team is aware of how to use this, God forbid, in the case of an emergency. You want to make sure that you have a dedicated room where you keep all your supplies for the IV nutrition so that everything is nice and organized. You should make sure that you mix the IV solution as close to the time that you're administering it, just for the properties of making sure that it's as active as it is possible. All right, so as far as legal points are concerned, it's always important that you check specifically, like I mentioned earlier, state by state laws to make sure who can do what and what the actual certifications are that are needed to give an IV nutrition. The other thing that you want to make sure that you mention is that you want to make sure that you realize that this is something that you don't make a complete claim as far as what you are doing, meaning this may help boost the immune system, but you never want to really say this is going to cure cancer, this is going to cure X disease. So always make sure that you stay clear out of making any promises as far as the medical conditions that this may treat or may help with. So let's see. We are making sure that you know that you are doing a medical procedure. So documentation is of the utmost importance, and also know which pharmacy you're going to be dealing with. You're going to be needing a compounding pharmacy. Make sure you stick with somebody that is reputable, that has a certain level of sterile techniques that they use, so that you can make sure you have the best product to offer to your patients. A lot of these pharmacies, like I mentioned earlier as well, have a lot of protocols that are widely used. If you stick with protocols, you will be less likely to get into trouble as far as the IV nutritions that you're infusing. There are advanced techniques that do tailor and custom dosing. Be aware this is a course for beginners. So you definitely need higher level of training to really go into these specialized kinds of infusions. So we're talking about your standard infusions that you're going to find in most compounding pharmacies. Let's talk a little bit about the economic part of giving an IV infusion. They are priced anywhere from $150 to $250. Your profit margin is at least double from what is your cost. So you're talking about 1 hour of somebody sitting in your office getting an IV infusion, and you're making a pretty good anywhere from $100 to $200 as far as profit is concerned. So it's definitely something that financially is beneficial. All right, so as far as those pearls, we continue to make sure that you keep an eye on the patient. You're monitoring vital signs. That's also a great time for you to be monitoring your IV site. Most patients, if you're going to have some kind of complication, it's going to be related to your IV site. So infiltration, remember that you are infiltrating not just normal saline, but you actually have a mixture of vitamins and minerals that you're infusing. So they usually tend to be a little bit acidic. So when they go into the extravascular system and infiltrate around the tissues, it's usually not a good combination. So make sure that you periodically are looking at your IV site to make sure that everything is going into the vein and not into the surrounding tissue. Okay, so a lot of lounges or medical offices are offering these IV nutrition supplements. Remember that although it's now kind of been presented as this is the menu and you choose, remember you are the practitioner, so you dictate based on the history and physical exam of the patient what may be best for them. So sometimes people may not exactly know. Just remember that although we are in the customer service industry, at the end of the day this is a medical procedure, so you need to give them your best advice for what is best for the patient. All right, so other recommendations, to do or not to do blood work. The safest thing is to do blood work. Okay, so this is going to include your basic panel. It's going to include a list of different vitamin levels, because the point or the concrete evidence that you have to show a patient not only is do they feel better, but also your before and afters for lab results. So you order a full panel, patient's magnesium comes back low, you've replenished it with an IV infusion, and now it's back to normal. So this is something concrete that you can show a patient, like, look, this is where you were and this is where you're at now. So it's always a great idea to order a full panel of labs. You're going to know the patient's kidney function, which is very important. You're going to make sure that you rule out those cases where the patient may present with high levels of calcium, for example, and they didn't know it. So it can never hurt. It's always beneficial and highly recommended that you check labs on patients that you wish to do IV infusions. I'm going to click over here. All right, so let's talk a little bit about the possible complications that we should know about. More commonly, we're talking about phlebitis, so that's going to be an inflammation around the vein that you infused the IV nutrition through. That can be a result of an inflammatory process due to the fact that most IV solutions tend to be a little bit on the acidic side. So they're going to cause an inflammatory response sometimes in patients. Obviously, infection is a risk. Should not happen. You definitely need to make sure you educate your entire staff about using the most sterile and aseptic technique possible so that we can really, have no issues with infection. Let's talk a little bit more about the more serious complications. So air emboli, again, if you're properly filtering and flushing out your tubing, this should not be an issue, but know in the back of your head that that is a possible complication. A lot of the shock issues occur because the infusion is being done too fast, so always make sure you give yourself a good hour. Particularly at the beginning, you're going to be starting the infusion very slow. You can always increase the rate as the patient tells you that everything is being well tolerated. Like I talked about, infiltration. That's really one of the main things that we need to, know about and make sure that it doesn't happen, only because the tissue destruction in that area could be serious. And it's so easily avoided by just continuously monitoring your patient. Of course, patients that may not necessarily know that their heart isn't working optimally, so patients with history of CHF or patients that don't know they have a history of CHF, so you always want to be assessing respiratory rate, respiratory effort, patient comfort to make sure that everything is going according to plan. Okay, so we talked about infiltration. The first thing that you do, if God forbid it happens, is you stop the infusion. That should be an automatic. You stop the infusion so that you can stop any further damage. You are going to elevate the area, and you are going to watch the area, remove the IV. You can no longer continue to infuse the IV through that site. As far as phlebitis, it's something that we're going to continue to monitor to make sure that it doesn't progress into something like an infection. But phlebitis technically is an inflammation, so with some NSAIDs, which should be improving some elevation of the area. Thrombus is also a possibility. More rare, but basically it's developing a clot at the site where you did the IV. It could get infected. You can have just a small hematoma development, and it should resolve on its own. So it's something that you want to monitor closely. And then of course infection. So you're going to see redness, heat in that area. You're going to want to treat with antibiotics if that's the case. But again, the best treatment is that which you don't have to treat. So we're going to be training our staff appropriately so that infection is not a risk factor. Infection, if it does occur, definitely is something that you need to watch closely, because the last thing we want to do is have it become systemic, which can lead to the patient becoming bacteremic or worse off, septic. With your circulatory overload, this is where your history takes into, it's an important factor of what you're doing. If the patient tells you they have an ejection fraction of 5, this is somebody that you probably don't want to infuse with an IV infusion. So always weigh risk versus benefit. But occasionally you're going to have that patient that just didn't know they had that kind of issue. They were borderline. And again, the best way to really prevent that from becoming an issue is that slow initial infusion, making sure that when the patient comes in for that infusion, that you really give them that full hour to infuse slowly, and that continuous monitoring is also a great advantage. All right, so again, If, God forbid, the patient has an issue with like a circulatory overload, the first thing you do again is you stop the infusion. You want to make sure that these patients are sitting up. So if they were relaxed, laying down, you are going to be sitting them up because that's going to aerate the lungs much better. You're going to have that supplemental oxygen. The next step is, of course, you got to have 911 at a calls away so that you can make sure that this patient is appropriately treated at an advanced facility like an emergency room. At that time, you also want to make sure that your crash cart is in the room and you are ready for worst case scenario. If an air embolism does happen, it usually carries a very high mortality. So again, you stop the infusion, you get your crash cart, you call 911. There is a small chance that somebody could have an allergic reaction or a sensitivity. Again, that's the first step. Stop the infusion, get that crash cart ready, assess the patient to determine if an allergy anaphylaxis is what is causing the issue. You can pierce an artery when you're starting an IV. That's always a possibility. Best thing for that is to recognize it and to hold pressure at the site. But basically, those are the big complications that we have to worry about. So let's talk a little bit more now specifically. Remember, we talked about we're going to do our history and physical. So we're going to be asking if they've had an IV infusion in the past so that we can really kind of find out, did this person have a sensitivity? Were they having issues with the rate that the infusion may have been given in? We want to know if they had any kind of complications so that we can be aware of possible things that may happen during the time that you're giving them their infusion. We want to talk about comorbidities. So we want to know their cardiovascular status. We want to know their renal status and their immune system. Obviously, if this is a cancer patient with, no immunity whatsoever, you really, again, want to weigh the risks versus the benefits. When starting to bring this into your practice, you really want to stick to your typical patient. This is somebody that's healthy otherwise, maybe feeling tired, maybe overstressed, but otherwise has very little comorbidities and is otherwise relatively healthy. Those are the patients that you want to start with. You don't want to start with the patient that has cancer, that has, 50 medical problems. Those are the patients you're going to find yourself that are going to get you into trouble, and particularly when you're starting out and experience is low. Stay with the patients that are going to be status quo and not giving you any issues. Let's see here. Again, it's highly recommended that you get those screening labs. It's really going to help you kind of sort out those patients that didn't necessarily know they had issues, but do. Although not a contraindication, be very aware of patients that have high anxiety and tend to have panic attacks, particularly if this is their first time. It's somebody that you really have to be in the room with, reassure them, because it could easily turn into a panic attack provoking type of situation. Okay, as far as labs to get, you want to definitely make sure you get a CBC. That's going to give you, the hint if there's any elevation in the white cell count or really extreme lows of white cell count, both indicative of issues. You want to get the chemistry. The chemistry is going to give us our kidney function. It's going to give us our potassium levels. And then we want to get specialized tests. So like that calcium level, that magnesium level, these things are going to really be able to make a nice change as far as things that you can show that patient, again, the before you were low and now these are your levels now. Now we're going to talk a little bit more about specific cocktails. So the Myers cocktails, I'm sure everybody kind of has heard that word being used in the past. It is probably one of the most common cocktails that is used. Basically, the Myers cocktail has some form of B complex, vitamin C. You can combine some calcium, some magnesium, and then we dilute it in the solution of our choice, usually normal saline. There are many formulations for Myers cocktail. So again, once you decide which pharmacy you're going to work with and what levels and concentrations you feel comfortable with, that's going to really dictate, which one you're going to use. All right, so most people are going to be coming to see you because they're fatigued, they're tired, they have no energy. Now with this whole coronavirus crisis, a lot of people that are going to be seeking you is going to be for things that boost the immune system. So definitely Myers cocktail is in that list. And then you're going to get an array of patients that ask you for a very specific type of treatments. Can this help with my migraines? Can this help with my fibromyalgia? Can this help with my cancer? So just make sure, again, that you keep it very generic. It's always a great idea to under-promise and over-deliver. So just be cautious of what you're promising your patients these IV infusions can do. Okay. Here on the slides, you get to see some of the concentrations that you can find in the Myers cocktail. So again, we're talking about anywhere from 4 to 20 mLs of vitamin C, and this is a concentration of 222 milligrams per ml. So you could see that the amounts and the ranges vary widely. So again, magnesium, calcium, your vitamin B complex, and your vitamin C. That really makes up that Myers cocktail. But from that slide, you should take home that the concentrations vary widely. Obviously, the more concentrated the product, the higher your cost and the higher the retail price of the infusion. You want to find a level where you feel comfortable, meaning that you're not staying on the upper normal levels of safely dispensing some of these medications, like your magnesium levels and your vitamin C, but you're also not doing them so low that you're not going to get results. So it's a nice fine line of risk versus benefit, and where you feel comfortable as far as providing the infusions. Here is yet another formulation for a Myers cocktail. Again, you guys should have access to these slides. You can look through them. And again, depending on the pharmacy that you end up working with, a lot of them will be able to give you their formulations, what is widely used by most practitioners. So you can definitely go kind of in the middle to start with, so that you give something that is going to work and give you results, but not be on the higher end of concentration, so that you don't have to feel like you're, having to be extra careful as far as, infusing these medications. So let's talk a little bit about magnesium. So magnesium is great for the heart. It's a great smooth muscle relaxer. So it's one of those great things that we want to give. With magnesium, the thing that you have to worry about is the secondary side effect of hypotension. So at higher doses, that's a greater risk. So again, you're going to have to find a dose that you feel comfortable with, as far as not having that risk be such an issue, but giving a dose that's enough to actually give your patient results. Again, if you want to stick to the average and higher than average type of concentrations, know that you're increasing the safety of this by decreasing how fast you infuse the IV infusion. So make sure that you give yourself, again, that full hour to really infuse the IV vitamins, and that you're constantly monitoring the patient, and that your initial infusion rate is going to be a lot slower than when you're halfway or towards the end, because now you're really going to know if the patient is going to be hypersensitive to certain minerals or vitamins. So as far as vitamin C is one of those great antioxidants. So it's great for your health. It's great for your skin. It's just one of those medications that you definitely want to make sure you have in your IV infusions. It's going to be a nice anti-aging supplement. So vitamin C is also one of those vitamins that orally is not seen in high concentrations when it finally gets to your intravascular volume. So it is greatly advantageous to be able to infuse it IV rather than taking it PO. And here is a little illustration of that. You can take 200 milligrams a day. You can increase that to double the amount, and it just doesn't give you the same plasma concentration that you are with a much lower dose when you do it IV. All right, so we know vitamin C is a great antioxidant. The one thing, so the patients that you should be careful with is anybody that has a history of G6PD deficiency, kidney disorders, hemochromatosis, higher doses of vitamin C. We have to be careful with that patient population. So through history, we may be able to get some clues, but again, sticking to safer or on the lower end of the vitamin C doses will help to avoid this. Infusing it very slowly will also help in this. So you want to make sure that we are using vitamin C as an antioxidant. Vitamin C, of course, has pro-oxidant qualities. That's going to be more in the realm of those advanced, really customized IV infusions that is a little bit out of the scope for this course. But now we're talking more about cancer patients and using vitamin C as, trying to use them to destroy cancer cells. So again, let's stick to the basics. Let's stick to what's safe and what's going to help you and minimize any adverse risks. Okay, so let's talk about some of the vitamin Bs. Okay, we know that vitamin B, they play a role in fuel. So they basically give us energy. So I would say 9 out of 10 people are going to be complaining that they don't have enough energy, that they're tired, that they're fatigued. So what better vitamin complex to offer them than the B complex? You can give it intramuscular, and you can give it slowly through the IV. You want to make sure that you are careful with people with polycythemia, people that have issues with peripheral thrombus. So again, all this is hopefully obtained through the history. Here's more information as far as the dosing and the administration of the vitamin B12 complex. Another offset of the vitamin B complex is called MIC shot. This is going to be super common, particularly for practices that implement weight loss as part of what they do for patients. This is one of those great shots that you can offer as a supplement for any patient that you may have on a weight loss program, any patient that is coming to see you for body contouring type of procedures. This is an intramuscular injection. It takes you literally 1 minute to administer it. It is a quick money maker, and it's relatively safe. So it has your B complex, so that's going to be for your energy, and then it has 2 additional components, which is the methionine, isoinositol, and choline. And what that does is it helps the liver metabolize fat more efficiently. So as a consequence, it's going to help your weight loss patients lose weight more efficiently, and giving them energy as well. All right, so the other potent antioxidant that I want to talk about is glutathione. If not more important than vitamin C, as equally important as vitamin C, glutathione is just one of the best anti-aging, skin lighteners, antioxidants that you can use. So it's definitely something that you should have in your practice, particularly if you work with patients that have issues with melasma, hyperpigmentation, that are seeing you for anti-aging purposes. It's a great infusion or intramuscular shot that you can offer your patients. Here are a list of more benefits aside from the ones that I mentioned for glutathione. There's talks and papers written about the possibility benefits that it can have with Parkinson's disease, autism, chronic infections, kidney issues, liver disease. So it's just really one of those powerful antioxidants for overall wellness. So very important. Keep glutathione in the back of your mind because it's really something that, as ubiquitous as vitamin C is, you want to bring that into your practice and make it available and educate your patients about. There are more specialized infusions like the NAC. Again, I wouldn't recommend them for practices that are just starting to do this, but it is listed here, and we can definitely talk a little bit more about them. Don't forget your specialized minerals. So that's going to include your magnesium, your calcium, your zinc, your selenium. All these have very specific properties that give you overall wellness and help you maximize results as far as body functions and anti-aging. We talked about glutathione. Don't forget alpha lipoic acid, your coenzyme Q10. In your slides, you'll be able to read a little bit more about them. Another specialized custom antioxidant boosters that you can talk about include that entire list. But again, we're going to be sticking to the basic IV vitamin nutrition infusions that are going to be relatively safe, that are not going to require you to be doing your own calculations for osmolarity, because the more we customize, the more we get out of our routine, and therefore we're opening that door for possible mistakes. Okay, so here we're going to start with our decision matrix. Again, we're going to stick to the side of conservative, and we're going to leave the progressive for those people that choose to specialize in IV infusions for a very specialized subgroup of patients that include the chronic illness, the cancers, etc. Okay. So let's talk about IM versus IV. So some of the advantages of doing intramuscular. Less time. I mean, these are quick. Your nurse can do it, your medical assistant can do it. The fee is less, so it makes your patients be more apt to sign up for an IM shot. So you really have to weigh that. Sometimes doing the intramuscular injection is a faster way to make a little bit of money, and it's quick, so it can save you a lot of time. Similar bioavailability. It is safer because it doesn't require your continuous monitoring like you have to deal with the IV. Most people, I think, are okay with the idea of intramuscular shots, so it's easier for somebody to accept that and to go ahead and sign up for an intramuscular shot. Now, as far as advantages for the IV, we talked about the higher bioavailability, so you need less concentration to really get it to the area of the body that needs it. Like I mentioned, if you streamline the process, it should be a relatively safe procedure. it is trending. So you see IV lounges opening all the time now. That is the thing to do. If you're feeling overworked and overstressed, this is the place to go relax and infuse some vitamins in your body. Because let's face it, we are too busy to take care of ourselves. You know, it's hard to eat healthy. It's hard to find places that are actually going to give you, you know, well-rounded, you know, organic type of meal without a bunch of chemicals. What else? Let's see. So let's discuss some of the disadvantages. Cannot be administered following an IM injection. So remember that if you give something IM, that's the way you gave it. You're not following that up with something IV after that. You want to make sure that, you know, that basically you follow that rule. So you choose IV or you choose IM. You could see as a disadvantage that the price that you can charge for an IM shot is going to be less. But basically, if that's what the patient prefers, that's what you're going to do. As far as disadvantages for the IV, of course, we're talking about the need for continuous monitoring, which is going to require more staff, although you can charge more for that fact. And then you're opening the doors for complications like phlebitis, for infiltration into the tissue. So keep that in mind. So you're weighing risk and benefit and monetary gain and, you know, patient compliance. So either way, it's better than PO, whether you choose IM or IV, but it's really going to be a discussion to have with you and the patient. Again, we continue to talk about conservative IV infusions. Let's talk a little bit about absolute contraindications. So again, this goes back to that history that you're going to be taking. Sarcoidosis, very rare, but again, most patients that have that disease process know about it. So it's very important that you make sure you get a full and thorough history because hopefully that's the time that it becomes disclosed. Because of their high calcium levels, that's somebody that you really don't want to be infusing. We're going to leave that for the progressive, subspecialized IV infuser offices, that this is what they do for a living and this is what they breathe and eat every day. Somebody tells you that they suffer from heart disease, it's something that you want to be very concerned with. So if they tell you that they're very prone to arrhythmias, that they have heart blocks, that they have congestive heart failure, these, again, not your typical patient that you want to be infusing. So again, try to stick to that young, healthy population so you can stay out of trouble. Kidney disease, of course, chronic kidney disease, new kidney disease, unknown kidney disease. So that's where the labs come into play. We're probably not going to be dealing with anybody with severe burns. They're going to be in a hospital settings, or they're going to be seeing that specialized person that does just those custom IV infusions. If somebody tells you that they have something like Thompson disease, that they have hypoaldosteronism, again, those are histories that should come out at the beginning, and you should consider staying away from that. If they tell you they're allergic to the last IV infusion they had, it may not be a patient that you want to try to give another infusion to. All right, I told you to be aware of patients with severe anxiety, patients that have access issues. Those are the patients that you're going to have problems as far as infiltration being more likely. So always make sure that the day before the patient comes in that you let them know, please be well hydrated. So you want to be able to have optimal conditions so when you start your IV. Okay, So we talk about general dosing and administration. Again, I keep going back to the same thing. Don't get super bogged down by like, I need to know exactly how to make a solution when I'm done with this lecture. You are going to be in touch with a compounding pharmacy. There are many of them that basically create kits for you, so that everything is pretty much dummied down for you. This is kit number 1 that you're going to be issuing for this type of patient. It contains this kind of vitamins and minerals. They've taken care of the osmolarity issues for you, so all you have to do is mix and administer slowly with continuous monitoring, and 99% or more of the time you're going to be fine. So again, don't despair and think that I'm not ready to do this when I finish this lecture. The next step after you finish this lecture is that you are going to contact several pharmacies so that you can get pricing, you can get concentration, so that you can compare, and then you decide which way you want to go. Okay. So this is just going over that GFR calculator. A lot of labs will calculate this for you, but otherwise, this is easily accessible on Google for you to interpret. Okay, so we're going to go into commonly used IV nutritions. Let's see here. All right, so let's talk about first the base. So you are mostly going to be using normal saline. You can add dextrose to it. You can have a component of water. Remember that this all depends on the osmolarity and what you're using to make your compound. So at the end, of you calculating your infusion, you're trying to get an infusion whose osmolarity is as close as possible as your plasma. So there are no interactions and there's no significant fluid shifts. But again, I keep going back to the same thing. This is all going to be easily accessible through that compounding pharmacy that you're going to work with. All right, so different solutions have different osmolarities. Most tend to be a little bit hypotonic or isotonic, and then depending on what you mix it with will change the osmolarity. Here, again, we go back to that Myers cocktail that usually contains a mixture of that magnesium, that B complex, that calcium, that vitamin C. And here are a couple of those modified Myers cocktails, and you can see how some of them use a little bit different formulations and different concentrations of those formulations. Here are a few others. So when you contact that pharmacy, a lot of them, besides giving you a prescription and dosing of what's in them, they also will kind of guide you as to how to recommend them for your patients. So is somebody looking for a libido enhancing formulation? Is somebody really looking for something anti-aging? Are they looking to boost the immune system? Are they looking to perform better because they're feeling run down at work? So depending on the complaint, you will find that these pharmacies also tailor not just on a specific type of formulation, but they also guide you as to who can use these specific formulations. All right, so here is a list of the common vitamins, common minerals, common amino acids, and then some of the range of dosing that can be associated with them. So that vitamin B complex, calcium, magnesium, vitamin C, folic acid. You have a range of amino acids that you can add, and again, depending on that symptom and that patient complaint, you can really tailor that IV infusion. So the sky's the limit. I mean, you can stay basic, or you can really do very specialized kind of infusions, and it really all should depend on the type of practice that you have. So if your practice is largely anti-aging, you know, that may be the one you offer. If your practice is mostly weight loss, you may need something specialized for that. So it kind of depends on what you specialize in your particular practice, so that it makes sense and that it flows together, and so that it becomes an adjunct to what you do, and again, to maximize results, to be able to offer additional revenue, so that, you know, you can have a full 360 type of practice. Okay, so you want to make sure that the pharmacy that you choose has exceptional sterile preparations. That's really what is going to make the difference between one pharmacy and the other. It's your ability to replicate those infusions and to give them in the safest and most sterile manner possible. These pharmacies, and the reason that they're compounded in these facilities is because sterility is of the utmost importance. These infusions are usually not made with any preservatives, so their shelf life is limited, and sterility is super, super important. Okay, again, recommendation: always check your state laws to make sure that you are in accordance to them. You should definitely have standard operating procedures, particularly with that crash cart, how to set up the IVs, what the patients can expect, what the practitioner that is giving the infusion should expect. Everything should be labeled appropriately, should be stored appropriately, and you should keep a close eye on those expiration dates, because again, the shelf life of these preparations are usually not very long. Okay, so we're going to talk about the actual procedure of infusion, or placing the IV catheter so that we can give our infusions. We are going to be taking a little short break, so that if anybody needs to use facilities, get a little snack, we will reconvene shortly.
So I wanted to thank everybody for being part of part one of our day today, focused on IV nutritional therapies. As I mentioned before, there's a lot of exciting information that's been published on our calendar, on our website, and your members portal about our virtual training. Each and every one of you, now's the time to prepare yourself for what's going to happen over the next few months as you transition back into the workforce. Now's the time to separate yourselves from the rest of the organizations that aren't taking this time away from their practice to study, prepare, and stay focused. Throughout the rest of the day, we're going to be doing a live demonstration using a product from Liquivita, one of our pharmacies in Fort Lauderdale, Florida, distributed nationwide. In addition to doing our live demo, we've made a clear outline of all of the questions that you as the audience have written into the chat today. Dr. Vera will be answering each and every one of those questions, and we urge you, if you have any other questions, please let the chat know, and we'll be happy to answer all of them. We're going to take a quick break in a moment. Before we do, wanted to let all of our single seminar attendees out there aware that now's a great time to participate in what we call our Platinum, Diamond D, or Diamond membership. Feel free to enjoy all of these live stream programs as well as our live programs that'll be taking place shortly over the next few months across the nation. In 2020, we have plans to have over 700 live courses as well as our live stream. So whether you're with us in person or live streaming over the computer, thank you again for watching. And please watch a quick video of Liquavita and some of the products that they have to support. Thank you. What slide are we up to? What was the last slide?
So how long is the break for?
15, like 10, 45, 20
How long
minutes.
is that video?
This video is pretty much done. You can replay it one more time. We're going to take a 20-minute break now anyway.
That we want to also be able to do is to use small volume for bolus injection.
Like my entry point is going to be right here. Now, it's important to note the depth of placement.
The other thing that we want to also be able to do is to use small volume for bolus injection.
Like my entry point is going to be right here. Now, it's important to note the depth of placement.
thing that we want to also be able to do is to use small volume for bolus injection.
Like my entry point is going to be right here. Now, it's important to note the depth of placement.
The other thing that we want to also be able to do is to use small volume for bolus injection.
Like my entry point is going to be right here. Now, it's important to note the depth of placement.
other thing that we want to also be able to do is to use small volume for bolus injection.
My entry point is going to be right here. Now, it's important to note the depth of placement.
Action.
Dr. Vera, thank you for a great morning so far, sharing your pearls as it relates to IV nutrition. We have a handful of questions from the audience.
Okay.
And let's get started.
All right.
Do you have any favorite compounding pharmacies? Message from Johnny.
Okay, so I, in my practice, use Liquivita. That's who I prefer to use because they actually make the kits for me. Everything's pre-mixed, ready for me to just put together. So that's who I use. There are companies like Olympia is one of them, and Universal is another compounding pharmacy that has similar, kits available.
Okay. Are you doing lab work in the office, or do you outsource that?
So I currently have a lab in my office for patients that either want to pay cash or whose insurance we take. So it's kind of up to you. You can definitely write a prescription for your patients to go to their designated lab due to insurance reasons, or you can definitely contract with a laboratory to offer it in your office.
Fantastic. And Nana, are the labs before or after the initial treatment?
I always order labs before and then a set of labs after. So again, I can have that before and after to show the patient.
Oh, wonderful. As it relates to staffing, is it mostly nurses? What about medics?
So in the state of Florida, medics can give the infusions as long as a medical doctor is on site. But again, I definitely recommend that you look this up according to your state laws.
Fantastic. Nadu was asking, how often or how common is it to see complications?
Very uncommon. Knock on wood, I've never had a complication, but again, if you stick to the safe ways to run these IV infusions, you really shouldn't have any complications. A big part of that is choosing the correct patient population, infusing them slowly, and following those protocols that you're going to set forth.
Okay, and a follow-up to the complication question was, what can you tell us about sickle cell and vitamin C?
So sickle cell patients actually are deficient in vitamin C. So by default, they can use vitamin C supplementation. But again, we go back to that safe patient selection. If you know that somebody's a sickle cell patient that tends to go into crisis, the last thing, this is not the patient we want to start with. So this is an advanced patient treatment. If you're starting out, I recommend that you refer that patient out to somebody that does this on a regular basis.
Johnny, thank you for the questions. What would be the frequency for glutathione injections?
So everybody's frequency differs a little bit. So I get my glutathione from, I mentioned, Liquivita. It basically comes in a vial with specific formulations, and the dosing is 1 cc. I particularly offer it to patients either on a weekly, so 1 IM, 1 cc per week, bi-weekly, or monthly. It kind of depends on what we're trying to achieve, if the patient is really acutely in therapy versus more on a maintenance. And then you'll find other things like budgeting that usually come into play in your decision making.
And do you co-administer glutathione with vitamin C and other?
So yes, you can, but you can definitely do them separate. Normally when we do the Liquivita kit, we leave the glutathione for those last 15 minutes of the infusion. So we'll let the vitamin C run, and right when we're about, a quarter left of the actual bag, that's when we put the glutathione. But there are people who think that because they're antioxidants, that they should be given at different times. So you can do it together, but not so closely, or you can definitely arrange it to have be done on a separate day.
Oh, great. Nana was asking about lipo-MIC injections. Any recommendations for weekly dosing?
Sure. I mean, if you can get a patient to agree to weekly dosing, particularly if you have them in an acute plan where you're trying to do aggressive weight loss, absolutely. You can definitely do weekly.
Fantastic. How easy is it to deal with compounding pharmacies and the IV preps? I know you'd mentioned you use a product called Liquivita, which is pre-made in a kit, but if somebody wanted to go another route, what would be another option for them?
So again, the kits are the simplest way to go, and it's Liquivita is who I use, but it's not the only compounding pharmacy that does that. But you can definitely get each individual vials of your vitamin C, your glutathione, and perform your own mix, your own formulations. Again, just know that you have to calculate osmolarity for those, if you choose to do it yourself. So now you're just adding that extra work for you, that extra room for error, but it's definitely a way that you can go.
Okay. Robin had a question about which to use, methylcobalamin or hydroxycobalamin?
We use hydroxy.
Okay. And for the frequency of infusions, we've had a couple questions from the audience about what are some recommendations for patients, during flu season or throughout the year? What are the protocols for frequency of IV infusions?
I like to ideally have my patients come in at least once a month for the infusions. Again, I'm taking mostly into account budget. So once a month is a nice way to present it to them, because the equivalent of them buying those PO vitamins that they take is about the same. So usually I get no pushback from patients doing this once a month.
Okay, fantastic. Well, we're going to field a couple more questions over the next hour or so before lunch. But I know the audience out there is very excited to see a little bit more about what the procedure looks like and some of the placements. So looking forward to seeing some more.
Great. So we'll finish the lecture off. I just want to talk a little bit about the actual IV catheter and sites and that good stuff. So we're almost done with the actual slides, and then we can move on to the hands-on.
Fantastic. Looking forward to it, Doctor.
Thank you. Okay, so let's talk a little bit more about actual procedure. So this is a peripheral IV that we are inserting. My go-to site for this is going to be the antecubital area. Just typically they have bigger veins that you can see. But of course, you can use the dorsum of the hand. If the patient is really a poor, has poor vascular access, you can always go into the neck area for the external jugular, although most patients are not very keen on you stabbing them in the neck for an IV placement. So usually antecubital area is a great spot to go. All right, so you're going to do your setup first. You're going to decide which IV infusion you're going to go with. You're going to have everything set up, because if you're prepared, you can be ready for any unexpected, things that can go wrong, or, not what you're used to. Okay, so you're going to place your tourniquet. I typically ask the patient which side they are dominant, so right-handed or left-handed. I typically find the bigger vessels on their dominant side. I apply a tourniquet while I'm getting the last things set up, so that I can give time for that vessel to really dilate and be extra visible and plumped and ready for me. Make sure that the tourniquet is not too tight and that you're communicating with the patient, and then you're not leaving them with a tourniquet on without actually monitoring them. So if you leave the tourniquet on, I am in the room physically setting everything up as I'm monitoring the patient. All right, so make sure you have everything set up. Make sure you have extra syringes in case that you have to float the IV in. Make sure that you properly sterilize everything. So in my practice, I do a wipe with alcohol and then a second wipe with HibiCleanse. That's just what I choose to do to just make sure that that infection rate is 0. You are going to immobilize the vein. So remember, veins are cylinders, they can roll. So you want to make sure that you stabilize everything both proximally and distally. Your cannula is going to be beveled up. You're going to be inserting from distal in the direction of proximal. You are, depending on the type of cannula that you have, you're looking for that flashback. And I usually advance 1 millimeter to 2 after I see the flash to make sure that I'm really in the vessel. And then depending on the cannula again, some of them are made so that the blood doesn't come out. And some of them you have to actually hold pressure on the actual vein so that you don't get the blood spilling back at you when you remove the needle. After that, I use an IV connector. The reason that I like that is because I actually like to flush the vessel. My big thing is I want to make sure that I am in that vein. So after I put in the catheter, in my practice, I take the extra, cents to $1 that IV catheter costs me, but I have an IV connector, and then I actually flush to make sure that I have good access to that vein, so that I feel very comfortable that that IV catheter is in the correct place. So we're done flushing, and then the next thing is that we're going to dress it and secure it, because the last thing you want is, yay, you're in the vessel and then you're in a hurry and the IV pops out. So make sure that after you flush and you confirm that you're in the correct place, I use a Tergoderm over the IV site, and then I do an additional piece of tape distal to that so that I can make sure that my IV is totally secure and it is not coming out and it is not moving out of place. Here is an illustration of some additional vessels that if you end up not going into the antecubital area, you can move a little bit more distal into the cephalic vein. At the junction of the wrist there, when you bend the wrist forward, you're really able to get a little vessel to pop in that area. It's a little painful at that site, but if that's all you have, that's all you have. All right, here's some more vessels that you can go into. Of course, you can also use the wrist. As you move more distally, just remember it's a little bit more tender. All right, here is a list of some of the pricing that you can expect. And that is just an average. Depending on what you want to do with this Liquid Vita, or if you choose any other pharmacy, you want to design your business model. So is this something that you're going to do adjunct to your practice? Are you going to be a lounge, an IV lounge? Are you going to be doing this mobile? Take all those things into consideration when choosing the type of pharmacy that you're going to work with. And if you're going to go with a kit that's preset and ready to go versus something that you have to mix yourself. Remember, this has to be done sterilely. So ideally you want a hood, a vented hood. That's why a lot of people are really kind of going to those kits, which are pre-made, so that everything remains sterile and it's for that patient one-time use only, as opposed to multi-dose vials. Here are some other things to consider as far as your compounding pharmacy. Pre-mix, again, some average pricing that you can expect to see on the market. These are actual other names of some pharmacies that are in the business of compounding. Here's a summary of a list of the different amino acids and the different vitamins and minerals that you can create in your IV infusion. And this brings us to the end of our lecture. So the next phase is going to be to actually show you Liquid Vita pre-mixed kit, how it comes presented, how easy it is to do this. And again, just remember, you want to do this in a safe manner. You want to really make sure that you choose your patients appropriately. You want to make sure that you infuse everything slowly, that you use aseptic technique. If you follow these simple rules, you should be fine. You should be able to infuse almost anybody, because a lot of these people with the chronic illnesses and the actual contraindications, they already know that they have to go to like a very specialized area to do this. So without further ado, we're going to take a little break so I can do my setup, and then we're going to be demonstrating an infusion. All right, thanks guys for watching.
The other thing that we want to also be able to do is to use small volume for bolus injection.
Like my entry point is going to be right here. Now, it's important to note the depth of placement.
That we want to also be able to do is to use small volume for bolus injection.
my entry point is going to be right here. Now, it's important to note the depth of placement.
Am I looking over there? Hi guys, so we're back and I want to answer a few more questions that are coming in.
Okay. How soon after the infusion do you repeat lab work?
So I typically repeat blood work about a week later.
Fantastic. Can you please review again the dosing for glutathione?
So the dosing for glutathione, again, it depends on the pharmacy that you're using, and the dose also depends if you're doing IV versus IM. So it's kind of hard to, give you an exact dose because it's going to depend.
And the glutathione is given IM or IV post-infusion?
So if you have somebody that's getting an infusion that's IV, then you're going to be adding that glutathione through the IV. So you actually add it to the bag when the bag is about a quarter filled, and then it's just going to go through the IV.
Okay. And give us a little information about fast drip versus slow drip for the IV.
All right, so slow drip is the way to go, guys. Number one, if there's magnesium in the drip, you can cause hypotension. If somebody's gonna have a reaction, not an allergic reaction, but just a reaction like flushing or nausea, that's all gonna be decreased significantly the slower that you infuse, the therapy. So please, slow is really the only way to go so that you're safe and that you stay out of trouble.
Robin is asking if you can repeat the information critical for vitamin C infusion, then giving the glutathione at the end.
So basically, I'll give you an example. I do my anti-aging infusion. So it's mixed primarily with the vitamin C, the minerals, and the vitamins. We start infusing it. About 45 minutes into the infusion, I have about a quarter of the bag, IV bag left, and at that time, I take that final vial of glutathione and I put it in my bag and then continue to finish the drip those last 15 minutes with the glutathione and everything else that's in the bag.
Can you tell us a little bit about what syringes and particular gauge needles you recommend? And does that vary by patient based on age, sex, male, female, etc.?
So typically I use a 20 gauge. If the person tells me that they have sensitivity to needles, I may use a 22. I typically try not to use anything smaller than a 22 unless the patient has really tiny veins, and then maybe a 24. Just remember, the smaller the needle, although a little bit less discomfort, the slower that you're limited as to how fast you can give the infusion. So typically 20, sometimes 22, those are my go-to catheter sizes.
have you had other placements, for example, back of the hand, etc.?
Yes, so typically I like the antecubital area. I have placed some IVs on the dorsum of the hand, some IVs right here at the bend of the wrist, and then, believe it or not, a few people that they know they have bad peripheral IVs, I've actually put in some external jugulars, which honestly tend to hurt less. It's just more about the patient kind of getting over the fact that you're stabbing them in the neck.
If the hydroxycobalamin is supplied as IM administration only from the compounding pharmacy, do you still use in the IV fluid?
No, it's one or the other. You got to choose which route you're going to go with that day. So that's not to say if today I do IV, then the next time I do an infusion, you can do an IM if you wanted to.
Okay, Robin Burnett is asking, how much NS do you use to dilute the glutathione in the syringe for IV push? And do you dilute the glutathione at all?
We do not do glutathione IV push. You have to slowly infuse it over at least 15 minutes. So it's either done as an IM shot or you put it in your infusion to infuse through the IV slowly.
Okay. Does anyone in the industry prefer an IV pump?
You're incurring cost, so typically no. Particularly with Liquivita, again, that's who I use. You have the ability to graduate how fast you want the IV to pump with the actual tubing that they supply. So I think that doing an IV pump is overkill, but if you happen to have one sitting at home, by all means, put it to use. It looks good, but it's at all not necessary.
How can the IV doctor send a nurse to the house if they don't have a crash cart?
Good question. So if anybody is coming to you for a mobile type of IV infusion, they should have a crash cart with them.
How do you vary IV treatments for young, healthy patients versus here in Florida, we've got a little bit more of an older community?
It's all, again, in the history taking, but if somebody is somehow, giving me that sixth sense that, they're older, they might be more frail, they used to smoke, they may have COPD, hypertension, diabetic, I suspect maybe there's a little bit of a heart issue, I'm typically just going to go and infuse slower. But again, if they have any significant comorbidities, the answer is I'm going to refer you out to a specialist.
Can you review again the crash cart?
So your crash cart, just imagine anything if the worst case scenario is a patient codes on you. So you want to ideally have an AICD. You want to be able to have epinephrine. You want to be able to have oxygen. And you want to be able to have an ambu bag so that you can be bagging this patient while the rest of your staff is calling 911.
Is it possible to purchase a pre-assembled crash cart kit, or do you advise going through each product individually?
You can order pre-assembled kits, but the cost is significantly higher. Remember, some of these have medications as well, and all this equipment actually has expiration date. So it's very important that you keep that in mind for office purposes, that you keep up with the expiration dates of both the products as well as the equipment.
Okay. For the hangover bags, Zofran or Reglan, do you have any preference?
Usually Zofran is my preference. Reglan sometimes it's associated with dystonic type symptoms, and there you would need to use a little bit of Benadryl to counteract that. So Zofran is my go-to antiemetic if I'm going to use it.
Okay. How have you been able to speak with patients that are coming in for non-IV therapy procedures to talk to them about the features and benefits of this procedure?
All right, so that's a great question. So I want to give you like real life scenarios here. So my go-to Liquivita IV infusions are going to be my anti-aging type of infusions. So whenever somebody comes in asking for fillers or Botox, I always, during the consultation, because this is your time to really make sure that you evaluate the patient fully and give them all the treatment options, usually that's when it comes up. So I will discuss with them, absolutely, we're going to do Botox, we're going to do fillers, this is going to help with this on the exterior. Just so you know, we treat the patient fully. So part of the anti-aging process is to make sure that we're optimizing your levels from within. So that's when I offer my patients the IV infusions, the bioidentical hormones. I sometimes touch upon the weight loss program that I have as well. And then anybody that comes to me for any type of pigment, like automatically, I almost let them know part of the treatment regimen that you're going to be embarking with me is going to be glutathione. So whether you choose to do it in the IM form or in the IV form, part of the regimen and optimizing the fact that you are making an investment with me is to do everything possible. I often use the metaphor like I want to throw the kitchen sink at you because everybody responds in a different manner. So lasers work great, but if I can do something to kind of help the body heal from within and optimize my results, like why not? And thirdly, every patient that comes through my office that's a new patient gets a full tour of the office where the girls discuss every procedure that we do, so that they are introduced to the fact that they're going to know that we do IV infusions. Also, when they're sitting in the waiting room, we have literature as well as videos that they can kind of see exactly what we do in this office and what we offer and what are the advantages.
Zofran, do you add this to the hangover bag or IV push?
Only if needed. So we've actually had some patients that have come in with active hangover. So they have an IV in one hand and the garbage bag waiting so that they don't vomit on the other hand. So absolutely, those patients, I will add the Zofran. With those patients, actually, if you're actively vomiting, I usually add it through the IV connector so that they can get their dose through IV per se. But if they're just feeling nauseous and they're just not feeling that good, then I'll add it to the bag so that over that hour, they're getting those 4 milligrams of Zofran. But if they're acutely vomiting, I usually will bend my tubing and then so that I can isolate it, and then I can use that side port and just infuse the Zofran IV.
You've been a pioneer and a leader in the medical community for many years in anti-aging and aesthetics. Why do you think IV nutrition has become more popular over the last few years?
So, like everything, social media, trends, IV nutrition has been around for a really long time. And those clinics that specialize in it are the ones that have been doing it usually the longest. But really, it's kind of just patient education through social media so that people are now really just requesting it. So you almost kind of have to have that as part of your practice to kind of keep up with the demand. And again, it's income that you're leaving on the table if you're not being a part of this. You can order as much or as little product as you want, but the last thing you want to do is somebody that comes in and they're getting their laser for hyperpigmentation and they're like, what else can I do? And then you're like, well, I mean, you could get glutathione. Oh, great, tell me more. I don't offer it. So like that's the last thing you want to tell a patient. So just part of it is just patient awareness through social media. So it's something that is very popular right now. So you really should really think about how you can integrate it in your practice, at the very least part-time.
Fantastic. Question from Joseph in California is, what are some of my next steps? I'm looking to get started in the next few weeks. Where would you start day one?
Okay, so day one, do you know how to start an IV? The answer should be yes. Next is let's find a pharmacy. So in your slide, you had a number of pharmacies. I told you about Liquivita, Universal, and Olympia. I would reach out to all of them, see what kind of rapport you experience with each company, see what kind of pricing they are willing to help you with, and then you order the product and you're ready to go. Make sure, please, that you have your crash cart, that you have a protocol list, so anybody that's going to be involved in supplying or infusing the IV, that they know exactly what the protocol is and what the plan of action is if, God forbid, something goes wrong.
Which particular treatment do you find most popular in Florida, and do you feel that is the same throughout the nation?
Every region is a little bit different. I mean, even in Florida, like if you go to South Beach, it's all about the hangover infusion. Me, particularly in my practice, I deal with a lot of hyperpigmentation. So for me, it's all about that antioxidant. So vitamin C and glutathione, the anti-aging one and the hyperpigmentation infusions are my biggest source of infusions that I do in my practice. So thank you guys. If you have any further questions, please go ahead and keep sending them in. We'll be answering them as they come in. We're going to be setting up to do our live demo next.
That we want to also be able to do is to use small volume for bolus injection.
My entry point is going to be right here. Now, it's important to note the depth of placement.
With Dr. Vera. Dr. Vera is out of Fort Lauderdale, very good physician. Tomorrow we have the with Dr. Vera. Dr. Vera is out of Fort Lauderdale, very good physician. Tomorrow we have the Good morning, Dr. Cosentino. Hopefully everybody's doing well health-wise. Above all, that's the most important thing, so I really wish everybody the best health. Right now, I'd like to make a few announcements with what we're doing in Empire Medical Training. All our curriculum, aesthetics, anti-aging, pain management, we're broadcasting on live stream, all right? And these are not videos from the past. These are actually, we're working with our team of physicians. Today we have our IV nutrition program happening with Dr. Vera. Dr. Vera is out of Fort Lauderdale, very good physician. Tomorrow we have the neurotoxin program with Dr. Sharabi, triple board certified physician. On Sunday we actually have two programs, the advanced neurotoxin and fillers and also the dermal fillers. And I would just ask you to kind of take a look at the schedule because we have 700 programs going on over the year. And the best way to participate in this is really just look at the date, look at the location. All those programs we're still continuing. The other nice thing about this is we're covering all the didactic, even if it's a hands-on program. So the idea behind this whole thing that we're doing with the live stream is that we want you to take this time to ramp up, okay, to use this downtime to try to learn as much as you can, to try to grow your practice, all right? So you could either be sitting at home with doing nothing, or you could be really working on trying to grow your practice. And that's the belief that we have. Then when this is all over, all the programs are still going to be on the schedule. You could attend any one of those programs, do the hands-on, and you could actually skip the lecture part. On Sunday, we have Dr. Keston, who's a ophthalmologist and eye surgeon, and again, he's going to be doing those two programs. He's right in New York City, right in the middle of all this, and I want to thank you, Dr. Keston, for working with us in spite of all this. So again, the whole curriculum, stay well, stay healthy, and really take this time to ramp up your practice. And I look forward to meeting you in person. Dr. Cosentino. Hopefully everybody's doing well health-wise. Above all, that's the most important thing, so I really wish everybody the best health. Right now, I'd like to make a few announcements with what we're doing in Empire Medical Training. All our curriculum, aesthetics, anti-aging, pain management, we're broadcasting on live stream, all right? And these are not videos from the past. These are actually, we're working with our team of physicians. Today we have our IV nutrition program happening with Dr. Vera. Dr. Vera is out of Fort Lauderdale, very good physician. Tomorrow we have the neurotoxin program with Dr. Sharabi, triple board certified physician. On Sunday we actually have two programs, the advanced neurotoxin and fillers and also the dermal fillers. And I would just ask you to kind of take a look at the schedule because we have 700 programs going on over the year. And the best way to participate in this is really just look at the date, look at the location. All those programs we're still continuing. The other nice thing about this is we're covering all the didactic, even if it's a hands-on program. So the idea behind this whole thing that we're doing with the live stream is that we want you to take this time to ramp up, okay, to use this downtime to try to learn as much as you can, to try to grow your practice, all right? So you could either be sitting at home with doing nothing, or you could be really working on trying to grow your practice. And that's the belief that we have. Then when this is all over, all the programs are still going to be on the schedule. You could attend any one of those programs, do the hands-on, and you could actually skip the lecture part. On Sunday, we have Dr. Keston, who's a ophthalmologist and eye surgeon, and again, he's going to be doing those two programs. He's right in New York City, right in the middle of all this, and I want to thank you, Dr. Keston, for working with us in spite of all this. So again, the whole curriculum, stay well, stay healthy, and really take this time to ramp up your practice. And I look forward to meeting you in person. Cosentino. Hopefully everybody's doing well health-wise. Above all, that's the most important thing, so I really wish everybody the best health. Right now, I'd like to make a few announcements with what we're doing in Empire Medical Training. All our curriculum, aesthetics, anti-aging, pain management, we're broadcasting on live stream, all right? And these are not videos from the past. These are actually, we're working with our team of physicians. Today we have our IV nutrition program happening with Dr. Vera. Dr. Vera is out of Fort Lauderdale, very good physician. Tomorrow we have the neurotoxin program with Dr. Sharabi, triple board certified physician. On Sunday we actually have two programs, the advanced neurotoxin and fillers and also the dermal fillers. And I would just ask you to kind of take a look at the schedule because we have 700 programs going on over the year. And the best way to participate in this is really just look at the date, look at the location. All those programs we're still continuing. The other nice thing about this is we're covering all the didactic, even if it's a hands-on program. So the idea behind this whole thing that we're doing with the live stream is that we want you to take this time to ramp up, okay, to use this downtime to try to learn as much as you can to try to grow your practice, all right? So you could either be sitting at home with doing nothing, or you could be really working on trying to grow your practice. And that's the belief that we have. Then when this is all over, all the programs are still going to be on the schedule. You could attend any one of those programs, do the hands-on, and you could actually skip the lecture part. On Sunday, we have Dr. Keston, who's a ophthalmologist and eye surgeon, and again, he's going to be doing those two programs. He's right in New York City, right in the middle of all this, and I want to thank you, Dr. Keston, for working with us in spite of all this. So again, the whole curriculum, stay well, stay healthy, and really take this time to ramp up your practice, and I look forward to meeting you in person. Dr. Cosentino. Hopefully everybody's doing well health-wise. Above all, that's the most important thing, so I really wish everybody the best health. Right now, I'd like to make a few announcements with what we're doing in Empire Medical Training. All our curriculum, aesthetics, anti-aging, pain management, we're broadcasting on live stream, all right? And these are not videos from the past. These are actually, we're working with our team of physicians. Today we have our IV nutrition program happening with Dr. Vera. Dr. Vera is out of Fort Lauderdale, very good physician. Tomorrow we have the neurotoxin program with Dr. Sharabi, triple board certified physician. On Sunday we actually have two programs, the advanced neurotoxin and fillers and also the dermal fillers. And I would just ask you to kind of take a look at the schedule because we have 700 programs going on over the year. And the best way to participate in this is really just look at the date, look at the location. All those programs we're still continuing. The other nice thing about this is we're covering all the didactic, even if it's a hands-on program. So the idea behind this whole thing that we're doing with the live stream is that we want you to take this time to ramp up, okay, to use this downtime to try to learn as much as you can to try to grow your practice, all right? So you could either be sitting at home with doing nothing, or you could be really working on trying to grow your practice. And that's the belief that we have. Then when this is all over, all the programs are still going to be on the schedule. You could attend any one of those programs, do the hands-on, and you could actually skip the lecture part. On Sunday, we have Dr. Keston, who's a ophthalmologist and eye surgeon, and again, he's going to be doing those two programs. He's right in New York City, right in the middle of all this, and I want to thank you, Dr. Keston, for working with us in spite of all this. So again, the whole curriculum, stay well, stay healthy, and really take this time to ramp up your practice, and I look forward to meeting you in person. Cosentino. Hopefully everybody's doing well health-wise. Above all, that's the most important thing, so I really wish everybody the best health. Right now, I'd like to make a few announcements with what we're doing in Empire Medical Training. All our curriculum, aesthetics, anti-aging, pain management, we're broadcasting on live stream, all right? And these are not videos from the past. These are actually, we're working with our team of physicians. Today we have our IV nutrition program happening with Dr. Vera. Dr. Vera is out of Fort Lauderdale, very good physician. Tomorrow we have the neurotoxin program with Dr. Sharabi, triple board certified physician. On Sunday we actually have two programs, the advanced neurotoxin and fillers and also the dermal fillers. And I would just ask you to kind of take a look at the schedule because we have 700 programs going on over the year. And the best way to participate in this is really just look at the date, look at the location. All those programs we're still continuing. The other nice thing about this is we're covering all the didactic, even if it's a hands-on program. So the idea behind this whole thing that we're doing with the live stream is that we want you to take this time to ramp up, okay, to use this downtime to try to learn as much as you can to try to grow your practice, all right? So you could either be sitting at home with doing nothing, or you could be really working on trying to grow your practice. And that's the belief that we have. Then when this is all over, all the programs are still going to be on the schedule. You could attend any one of those programs, do the hands-on, and you could actually skip the lecture part. On Sunday, we have Dr. Keston, who's a ophthalmologist and eye surgeon, and again, he's going to be doing those two programs. He's right in New York City, right in the middle of all this, and I want to thank you, Dr. Keston, for working with us in spite of all this. So again, the whole curriculum, stay well, stay healthy, and really take this time to ramp up your practice. And I look forward to meeting you in person. Dr. Cosentino. Hopefully everybody's doing well health-wise. Above all, that's the most important thing, so I really wish everybody the best health. Right now, I'd like to make a few announcements with what we're doing in Empire Medical Training. All our curriculum, aesthetics, anti-aging, pain management, we're broadcasting on live stream, all right? And these are not videos from the past. These are actually, we're working with our team of physicians. Today we have our IV nutrition program happening with Dr. Vera. Dr. Vera is out of Fort Lauderdale, very good physician. Tomorrow we have the neurotoxin program with Dr. Sharabi, triple board certified physician. On Sunday we actually have two programs, the advanced neurotoxin and fillers and also the dermal fillers. And I would just ask you to kind of take a look at the schedule because we have
The Lounge. We provide nutrient IV kits to thousands of doctors nationwide. Today we are here in the office of Dr. Carolina Vera. I'd like to say thank you to her for having us here, along with Dr. Cosentino, founder of Empire Medical Training. Liquivita provides nutrient IV therapy. We have a sample kit here, which you're going to be seeing Dr. Vera later on do a demo with one of our beautiful models as well. Our IV kits consist of everything you need to administer an IV. You don't need to order additional supplies to administer this IV. Our IV kits are preservative-free, and they contain single-dose vials produced by a 503B FDA pharmacy. We work with several doctors throughout the nation and also several different pharmacies, which are all FDA regulated. We use non-corn source ascorbic acid, which is vitamin C, that comes directly from the cassava root. Our competitors usually offer 5 grams of vitamin C, where we offer 25 grams of vitamin C in our kits. We also offer 20,000 milligrams of glutathione for optimal results. We have 9 signature kits which come fully packed with all the supplies you need to administer that kit, which includes the 500 milliliter bag or 1,000 milliliter saline bag. It also includes the IV administer set, a 60 cc syringe for mixing, the IV catheter, an 18 gauge needle, 1 pair of gloves, and 1 tourniquet, 1 roll tape, 1 PVC prep, 2 gauge sponge, and 1 transparent dressing. So you can see we have everything that you need to administer the IV kit. There is an approval process with the pharmacy for you to have this product in your practice. It takes anywhere from 24 to 48 hours to get approval. With the influx of orders that we currently have due to the coronavirus, if this is something that you are interested in doing, I suggest you get approved right away. Even if you're not sure that you yet want to carry these IV kits, it's best to get approved so when you are ready to go, all you have to do is place your order. If you're interested in finding more information out about our IV kits, you can go to liquivitalounge.com or you can email me personally, loren@liquivitalounge.com. All that information will be provided for you after this video. All of our kits range anywhere from $65 to $145. That is your cost. We also have a formulation sheet that breaks it down to retail, cost, and profit for you. We're going to go to Dr. Vera, who's going to be doing the actual demo of a kit so you can see how simple it is to administer this IV.
Good job.
Okay, so Nick, you know what to do with Alessandra?
What?
No, I want to make sure Nick has all the cameras ready.
Oh.
I'm gonna play it one more time, right?
No, you have something different to play?
Oh, do I lay
Do you want
back
me to lay
or
down or
what?
more up?
No,
you can
you can lay
start
back. Yeah, you can start up and then like we'll chat.
Okay, I'm just gonna put this.
You can put it on your side.
Okay.
Hold on, silent.
I'm listening to her.
Yes.
I'm listening to her. You live
Oh, I am.
on the camera.
Hi guys. So we're back. I just want to quickly go over what I would typically do with a patient. So hi.
Hello.
So we've already met. We've already signed the consent. So remember, we don't start procedures until we sign consents. Vital signs have been taken, initial vital signs by my assistant. And then I've already done a physical exam on her, and we've kind of already chatted as far as any history. So she is a healthy, otherwise normal state of her health young lady. And I just wanted to bring this with me to show you guys. So typically, while the patient's waiting in the waiting room, they have access to the booklets that they could kind of see which IVs we use. If they wanted to discuss a little bit further, there is a nutrition guide that we can kind of really go through if she had any particular complaints, whether it ranged from fatigue to anxiety to dehydration, depression, diabetes. The list goes on. This is a nice kind of supplement to aid in you, choosing the right IV nutrition for your patient. All right, so we have decided what we're going to do for her. This is what the kit for Liquivita looks like, and this is the company that I use. The reason that I really like working with Liquivita is that they supply basically everything that you need in a box. So when we open this up, we're going to notice that it comes with the ingredients that we're going to be using. It comes with my IV catheter. It comes with everything to clean and secure the IV. It comes with the IV fluids, exactly what you need. They give me a large syringe so that I can draw the ingredients and put it into the IV. And then it comes with the tubing that I'm going to be needing. The only additional things that I like to use, and again, this is just extra added safety. I use an IV connector as well as a flush because I want to make sure that I'm in the vessel. I have Band-Aids here. I have 2x2s. I told you guys that I like to do alcohol and HibiCleanse. I always have extra tape just so that I can make sure that I don't run out of tape if I need to secure the IV. And then I actually like to work with 10cc syringes. I just find that it's a little bit easier as far as me handling it with one hand to be able to draw the items. So one of the first things that I like to do, which I already did, was ask her if she was left-handed or right-handed. So we are going to go on her right side. And while I'm getting everything ready, I always like to apply my tourniquet so that, again, I can start having that vessel kind of pop for me and just become extra obvious. So I want to make it tight, but I want to make sure that she's comfortable. You're okay?
Yes.
Perfect. Okay, if I didn't mention, the kit actually comes with gloves as well. It's just that I like my black gloves. All right, so Christina's gonna be coming in the room. She's gonna be assisting me because you always have to be ready for any kind of emergencies or any little unexpected things. All right, so here's some alcohol. Guys want to make sure that you clean that area well. Make sure that tourniquet is out of the way for you. All right, I always like to have a little extra 2x2 ready in case anything kind of bleeds, that I don't make a big mess. Okay, so I'm going to get my catheter ready, and then I usually give my assistant the IV connector so that she's ready to pass that on to me. And I also have my flush ready. And then I keep nearby my Tegaderm and my extra tape that I like to use. So here you go, Christina. All right, so this is a 20 gauge. That's what comes with your kit. Always make sure that you kind of know how the catheter works, because every mechanism is slightly different. So the last thing you want to do is find the vein and then you're not sure which way you have to push. All right, so have the patient make a fist, and that usually helps you to kind of find the vessel. You doing okay? All right. Perfect. So I mentioned earlier, I like to try to go into the antecubital area whenever possible. She seems to have a nice little vessel in this area that I can palpate. I like to make sure that I stabilize so that it doesn't roll. And then I'm going to simply go into the vessel and start my IV. So tiny little poke. Okay, I see my flash. I go in a little bit further just to make sure we're in. Okay, I let go of the tourniquet. I have this ready here, and then Christina's going to give me the IV connector. You're going to remove that, and you're just going to pop it in here for me so that we don't make a mess. Good, got that, got it, I got it. So make sure that you put your sharps away so that needle has a retractor. Make sure that you don't move this around too much. And then she's going to hand me the tegaderm so I can secure this IV first. Christine, I'm going to need you to hold right there for me. Just stabilize that. Got it? Okay. Okay. And then if you cut me a short piece of tape and then uncap that for me, and I'll take that. Well, you're cutting me a little tape that you're going to place right here. So I like to secure the IV with the tegaderm, and then I like to do an additional piece of tape right here, so in case that tegaderm moves, that it's still secured a little bit lower there. Right there, perfect. Beautiful. Okay, so now I want to make sure that this is flushing properly. So I'm going to push back, and you see that nice blood flow, and then I'm pushing in the flush, and I'm looking at that site. So I want to make sure that there is no accumulation of fluid in that area. So that's perfect. Everything feels okay? Yeah. No burning. Beautiful. All right, so our IV's in place. I'm going to go ahead and close that off, and then she can relax for a moment. So be comfortable. And then I'm going to now build my IV. So the first thing I do is hang this guy up here. Open that for me, the IV connector. So you want gravity in your favor, so you want to hang it high. We always have blankets available for the patients. Typically, they're in a room where they have access to a TV, or they can play on their phone. All right, so the next important thing is that you're going to flush this line. Remember, we talked about air embolisms, so we are going to not have that be an issue. So we are going to open this up, insert our catheter. And this is going to start running, and we're going to watch it come out all the way. So make sure you're by a sink or by an area that you can throw away, and you're watching all those little bubbles come out. Perfect. And then I bend it so that it stops, and now I'm going to connect it to the patient. Okay, so now we're connected. Good. This is that valve that I was telling you about. So you can control the rate through here, or you can control the rate through there, okay? I typically give it a little pump so that I can really see everything that is going to be infusing. So I'm going to close all that off. So everything is now connected, everything's nice and flush, and now I'm going to start adding my vitamin C and whatever nutrients and minerals that I picked. I told you guys that I like the 10 cc syringes just because it gives me a little bit less pressure on my hand. So everything is single dose, sterile, so I'm popping that off. I'm trying to minimize any touch that I have with the circuit. So I did not touch the top of that. I'm not touching the syringe. Pump a little bit of air, so I pull back on the syringe, and that just facilitates the drawback of the medication. It may take more than one syringe full to get everything that's out of the bag, but remember that's what's in the bag, so that's what you're going to be infusing. And this is... All right, so another little trick is when you use this 18 gauge, remember this is very sharp. So you want to make sure that you enter that IV bag totally in the center of it, because if you go at an angle, there's a chance that you can pierce that bag and you're going to start leaking. So these are little tricks of the trade that unfortunately you learn with trial and error. All right, so I like to mix everything before I start the IV on the patient. Okay. All right, so I'm going to close this back up. All right, and now we're going to open the site over here, and then you notice that my flow is very fast, so I'm going to slow it down. Initially, I want her to start feeling what the infusion is going to feel like, so I'm going to go very slow. You see that it's only a few drops a second, and everything is flowing through the system. Feeling okay? And I'm watching this site in particular, okay? I'm watching for any abnormalities in the tissue, any swelling, to make sure that my IV is in the right place. I'm asking how the patient is feeling, any signs of nausea, any signs of weakness. And then basically, as soon as I let this run for about 5 minutes at this rate, I just slowly start to increase the rate. And this is going to run for about an hour. Like, that is standard in my practice. Slow will get you always safe, so that you don't have any issues. All right, guys, and that's it. So she gets to relax for about an hour. This is her happy place. She can play on her phone, watch TV, movies, and voila.
Hopefully everybody's doing well health-wise. Above all, that's the most important thing. So I really wish everybody the best health. Right now, I'd like to make a few announcements with what we're doing in Empire Medical Training. All our curriculum, aesthetics, anti-aging, pain management, we're broadcasting on live stream. All right, and these are not videos from the past. These are actually, we're working with our team of physicians. Today we have our IV nutrition program happening with Dr. Vera. Dr. Vera is out of Fort Lauderdale, very good physician. Tomorrow we have the neurotoxin program with Dr. Sharabi, triple board certified physician. On Sunday we actually have 2 programs, the advanced neurotoxin and fillers and also the dermal fillers. And I would just ask you to kind of take a look at the schedule, because we have 700 programs going on over the year. And the best way to participate in this is really just look at the date, look at the location. All those programs we're still continuing. The other nice thing about this is we're covering all the didactic, even if it's a hands-on program. So the idea behind this whole thing that we're doing with the live stream is that we want you to take this time to ramp up, okay, to use this downtime to try to learn as much as you can, to try to grow your practice, all right? So you could either be sitting at home with doing nothing, or you could be really working on trying to grow your practice. And that's the belief that we have. Then when this is all over, all the programs are still going to be on the schedule. You could attend any one of those programs, do the hands-on, and you could actually skip the lecture part. On Sunday, we have Dr. Keston, who's a ophthalmologist and eye surgeon, and again, he's going to be doing those 2 programs. He's right in New York City, right in the middle of all this, and I want to thank you, Dr. Keston, for working with us in spite of all this. So again, the whole curriculum, stay well, stay healthy, and really take this time to ramp up your practice. And I look forward to meeting you in person.
So, Cara, we've got like, say, 3 or 4 questions,
Okay.
and that's it.
All right, ready.
All right, so Dr. Vera, we have a couple more questions from the audience.
Ask away. Tell me.
First question is going to be, can you review the kit specifically that you used in regards to the ingredients of this IV bag?
So in her case, so we chose the performance hydration. So this young lady works hard and plays hard. So she wants to feel more energized. So that's the kit that we chose. And basically the kit comes with the 2 vials that you're gonna need. And it comes with the amino acid complex that includes 25 grams of vitamin C. And I can read you the entire list if you want. And then it comes with your B complex. And then we put this entire contents of each vial into our mix, and then the osmolarity is already calculated for us. So basically we just put everything in that bag and then infuse slowly.
How long will the procedure take now that the patient is receiving her drip?
So this is I run my drips for an hour. So I calculate the rate so that she is getting that 500 cc volume plus the cc's that are in both vials in about an hour.
What are the post-procedural guidelines for your patient following a drip?
There's no downtime with this procedures. Normally I tell the patient just make sure you stay well hydrated. After a drip is done, we always make sure that we put the patient in the sitting position, make sure that they're not feeling dizzy or weak. Almost, 100% of the patients are going to want to go to the bathroom right after the IV. So we always want to take extra care that you sit up the patient, make sure they're not feeling drowsy, woozy, and we assist them, walking to the bathroom just to make sure that everything is normal, and usually that's it. Obviously, we make sure that we secure the IV, we hold pressure for about a minute. We put the Band-Aid and we just let the patient know to keep that Band-Aid on over the next couple hours just to allow closure of the hole that we made with the IV.
Okay, final question is going to be from Joe in Cincinnati, Ohio. Is following this patient's procedure, how often do you have multiple patients in one drip room, or do they use different treatment rooms?
So it kind of depends on your setup for your practice. So my practice is set up with 8 treatment rooms. So I can have 8 patients running, at a time, basically. So I always work with an assistant. They're always in charge of getting the consents, getting the kit set up, and having everything ready for me to come in and do my history, my physical, and start the IV. And then somebody is basically monitoring any patient that we have in an IV, like initially every 2 minutes, then every 5 minutes, and then every 15 minutes until the infusion is over.
Okay. You mentioned earlier that your patients are generally on a 4 to 5 week cycle for their IV nutritional therapies. What is the time frame of their next set of lab work?
So I usually will recommend that they come in once a month. So normally I have their lab work already done, so I have their results, and then I will give them a prescription so that hopefully before their next visit, so a month later, I'll have the results of that last repeat labs, and I can let them know, like, okay, so this is where you started, this is where you are now, so obviously this is working out well, let's continue the therapy.
What if a patient says they don't feel or experience anything right away? What are the time frames of full nutrient absorption?
So it's a very subjective type of feeling. It really is very specific to the patient. So if you find somebody that Typically, the patient that notices the biggest change right away is the patient that's super deficient on something. But if your typical patient isn't going to see a miraculous change, that's why I like ordering the labs so you can show them that before and after. But I just let them know, like, you know, these are the facts, this is the research. You may not be detecting immediate or, you know, over the top kind of changes, but this is definitely working. Keep up with it, you know, more than one time. And then long term, you're going to start seeing and noticing those subtle changes that you may not be picking up on initially. But typically patients, when they come in that second month, they have noticed that extra energy that they got from the IV.
What will be the dose for vitamin C and vitamin D3 for increasing immunity?
So again, depending on the kit and what you're trying to achieve is going to dictate the amount or the grams or milligrams of the different vitamins. In this case in particular, we did vitamin C at 25 grams.
Okay. And final question from the audience is, do you do skin brightening glutathione?
Yes, that's one of my favorites that I have. Like, any patient that sees me for any kind of pigment issue is either getting glutathione IV or is getting a glutathione IM shot once a month. Awesome. All right, guys. So if you think of any other questions, continue to send them in. If we don't have time to answer them today, I'm sure that somebody from our team is going to get back to you to give you some answers. But she's very comfortable. I'm continuing to monitor her IV. I'm going to go ahead and increase the rate a little bit more because she's very comfortable. And then that's it. She's here for another 45 minutes and she gets to relax. Thank you guys for joining me today.